Hi, I'm Amy Gamboa, and I'm going to be displaying today how to do a head-to-toe assessment. We're going to be using a mannequin, but we're going to also have a little voiceover, so you might see me talking to the mannequin and then having somebody else also answer in place of the mannequin, okay? So starting off, when you're coming in for your first assessment, first thing first, hand hygiene. You want to do that obviously before touching the patient. Introducing yourself to the patient, making sure that you're checking their armband, checking their name, having them state their name and their date of birth. While they do that, you can go ahead and ask them where they are. So for my purpose, can you go ahead and state your name for me, please?
Yep, Yasmin Perez.
Can you go ahead and say your date of birth?
It's February 7th, 1987.
And do you know where you're at?
Yes, I'm at Grossmont Hospital.
And do you know why you're here?
Yeah, I'm here because I had to have surgery to get my hip replaced.
Okay. And do you know what the date is today?
Yes, today is January 12th, 2017.
Perfect. So once they do that, I'm going to go ahead and just elevate your bed, just so I'm going to take some of your vitals right now.
Okay.
Oh, it's not plugged in, but okay. You're going to want to elevate your bed and then set up your vitals machine because you want to take vitals first off, especially since it's your first assessment. So I would have done vitals. You want to check blood pressure, temperature, pulse. Ask them if they're in any pain. That's probably going to be one of the first things you want to do, because if they're in pain, you want to do your pain assessment immediately and then continue on to do your head to toe. So once you've already taken your vitals, you can go ahead and just put that to the side. And then we are going to have my stethoscope here, which is my pen light. With your pen light, you're going to want to go ahead and assess your patient, but since they've been laying down for a while, you want to make sure that you check their head, check the back of their head to see if they've been, any pressure sores or anything are forming. So assessing the head, making sure, also checking the shoulder blades, they're good to go. As I'm doing that, I'm also checking the skin temperature of my patient's face, making sure all that's good to go. And then with your pen light, you have your pupil size here. You're going to go ahead and compare the pupil size. Okay, once you get that size, then you're going to flash a quick light because you want to see if they are reactant. So usually you're going to do it twice to see if they constrict and dilate. Go to the other side, just do the same thing. Next thing is you're going to want to have them follow the pen light. So go ahead and just look straight ahead.
Okay.
And then their eyes should be crossing over, so that is a good sign. While they're doing that, I usually do a quick check in their mouth. So I'll usually have them puff out their cheeks, smile, stick out their tongue. When they stick out their tongue, that's a good way to kind of just check out, making sure oral hygiene is good to go there. Also having them raise their eyebrows, and that's going to give me any signs of any neurological assessment, anything like that. I'm going to go ahead and listen to their lungs. So since I have a mannequin, I won't be having them raise forward, but usually with your patient, you're going to want to have them start off in the back and listen to the back. So usually you're going to do the midline and then go ahead and just check across the back line and then move yourself up. You're also going to want to see the symmetry of their breathing, so making sure that one side is not lower than the other, that they're actually compatible at the same time. So once you've assessed the breathing in the back, you can go ahead and just move on to the front. Listen to that. And then go ahead and you can unsnap their gown because you want to make sure that they're still covered, but also you're showing them some privacy. So listening, and then have them just breathe in and then breathe out. And then making sure that you're checking both sides to do any comparisons. And then, okay. And then while you're there, you can also listen to their heart at the same time. So starting off at your aortic, pulmonic, your herbs, which is usually where you hear any type of murmurs, and then tricuspid, and then mitral, which is at the base of your heart. That's where you want to listen to it at least for 60 seconds, just to make sure that when you took your vitals earlier, when you did the pulse, you want to make sure that you check the epical one to make sure if there's any discrepancy in ratio, because that would be something that you would have to notify your provider for. So after listening to the heart and to the lungs, you want to make sure you ask questions. So for the lungs, if they've had any issues with breathing, any difficulty breathing, like just sitting there, or if they're doing any type of activity, are they a smoker, are they on any oxygen, whether they're on oxygen here in the hospital, or if they take any oxygen at home or any type of medications. For the heart, you want to ask questions like if they have any heart issues that they're unaware of, any chest pain, anything in regards to cardiovascular pretty much. Also when we did like the whole puffing out the cheeks, you also want to ask questions about any recent headaches, any vision changes, any memory loss, any coordination issues, or any ringing in the ears. Those are going to be signs for other diagnoses that the doctor might have to be notified for. Also, we're going to have the patient go ahead and hold their arms up, and then you as a nurse will be pushing and seeing if there's any resistance, or having them push up against you as well, and that's going to show any type of strength. Crossing your fingers, I'll usually have my patient just go ahead and squish my crossed fingers, and that's going to measure out any grip strength. Going down on their arms, you're going to want to go ahead and do this at the same time. Go ahead and put this down. And this is asking to see if there's any pain at all going down their arms. I'm also looking at the skin color of their arms. I'm feeling for temperature. I don't see any bruising, lesion, cuts. All the colors evenly distributed. You also want to check for pulses, and you want to do this at the same time as well, making sure that they're together. And then also checking for capped refill. So you're going to go on the fingernails just briefly, seeing if the blood is returning back on there. So you do that on all of those. Quick little reference. Okay, and I don't see any puffiness or anything like that. You also want to ask the patient if they have any numbness or tingling in their arms as well. And then you can go ahead and continue on to move down. So we're going to check next is the abdomen, since we kind of pretty much did the upper portion. So first thing first is you want to just assess the abdomen. Look at it, see if they have any wounds, lesions, anything like that. Color is overall good. No puffiness, it doesn't look distended. Those are characteristics that you want to go ahead and look at. Then you can go ahead and take a listen. And you just want to go in, you can actually start here in all 4 quadrants, and then just move up, so kind of clockwise. And you just listen briefly to see if you hear any bowel sounds. Depending on their stage of their surgery, if it's before or after, it might vary. But if you hear absolutely nothing, then you have to go back in and listen for about 2 minutes in each quadrant. Then after that, you can go ahead and finish off just by palpating. And usually I'll ask my patient if they feel any pain here.
No.
Anything here?
No.
Anything here?
No.
And last, anything here?
No.
No? Okay. Other questions you want to ask with the abdomen is when their last bowel movement was. Depending whether it was today or it depends on their pattern. If they had any issues with their bowel movement, and how's their appetite. So what are they eating, how's their diet, etc. And then also for urination, when was the last time they urinated? Did they have issues, any painful during urination? Was there an odor? Was there a different color or anything like that? Those are characteristics we also want to know as well. So make sure that they let us know about all that. Continuing down, pretty much the same thing we did on the arms, we're going to go ahead and do them on the legs. And then if they're able to, you might need assistance depending on the type of procedure, but you're going to want to look at the back side of them. So if they're able to maneuver themselves, great. If not, you might need to bring in another RN or a CNA to help roll them over so that you're checking literally all the back side of their body. So same thing, you want to just go ahead and go down. Do you feel any pain, tingling, tenderness?
No.
No? Okay. I'm looking at the overall color. I touched it for warmth. I don't see any lesion, cuts, puffiness, anything like that. I'm also going to be checking for puffiness on the legs and also their pulse. So this is gonna indicate making sure that they have good circulation, literally from head to toe. And then you're gonna do your cap refill here as well. And then go ahead and have them pretty much pushing down on the pedal. This is also checking for strength. And then have them push against your hands as well. And then having them lift their legs up at the same time. Sometimes they can, sometimes they have to do one at the same, like alternate, so depending on the procedure. And that's also checking for leg strength. Lastly, you wanna go ahead and ask what their support system is at home. Do they have family? Do they live by themselves? Because depending on the type of surgery, for my patient, she's going in for a hip replacement. So there's some precautions that have to be followed. One of them being after surgery, they're gonna have to have a wedge in between their legs because you wanna avoid crossing their legs. Assistance getting in and out of bed using the restroom, because we wanna make sure that when they're getting up, they're keeping that leg stretched out, and also not bending over 90 degrees, because that's gonna be a biggie for any type of hip surgery or anything like that. Also, asking about their coordination, walking prior, making sure that they're not unsteady. We want to make sure all of that is good to go. So once you complete your assessment, just go ahead and let your patient know that you are finished, and then make sure you lower the bed before you leave and give them their call light. Okay? Thank you.